ಆಗಿದೆ. ಮತ್ತೆ ಇಂಪಾರ್ಟೆಂಟ್ ಏನಪ್ಪಾ ಅಂದ್ರೆ ಎದುರುಗಡೆಯಿಂದ ಯಾರಿಗೆ ನೋಡಿದ್ರು ಸರ್ಜರಿ ಆಗಿದೆ ಅಂತ ಕಾಣಿಸಲ್ಲ.
ಇಲ್ಲ ಕಾಣಿಸಲ್ಲ.
ಚಾನ್ಸ್ ಇಲ್ಲ. ಯಾಕೆ ಅಂದ್ರೆ ಹೇಗಿದೆ? ಚೆನ್ನಾಗಿದೆ ಸರ್. ಓಕೆನಾ? So nice and straight side. To this rhinoplasty patient now we are having cosmetic concerns in his nose. So you can see from the front profile, can you zoom in to his nose? So you can see that from the front profile he is having a very wide nose. So he is seeking reduction in this nose width. And also if you see the tip, it's drooping downward. So if you see the side profile, you can appreciate that his tip is drooping downwards and there is no tip support, it's collapsed. So in this surgery we are planning to give a good tip support and also give tip projection. Okay, and also if you see his radix, it's very low. Okay, so we are planning to do augmentation of the radix as well. Augmentation rhinoplasty. Now the patient is in the, so we'll be shifting the patient now to the OT complex. So this is the plan to lift the nose and to do subtle augmentation here to give septal support as we discussed. So we are using a rib cartilage for the augmentation to give the support, to give the dorsal aesthetic lines, to give all of the augmentation. We need a rib cartilage. So the plan is to take the 7th rib from this part on the right side, and this will be done under general anesthesia. We are planning to give oral intubation. The tube will be passed through the mouth, and using that anesthesia we are doing rhinoplasty as well as rib harvest. Both of the things will be done in one surgery. Thank you. ಬಾಯಿಂದ ಉಸಿರಾಡಬೇಕು. ಒಂದು 2-3 ದಿನದ ತನಕ ನಿಮ್ಮ ಮೂಗು ಬ್ಲಾಕ್ ಮಾಡಿರ್ತೀವಿ. 2 ಕಾರಣಕ್ಕೆ, ಒಂದು ಬ್ಲೀಡಿಂಗ್ ಆಗಬಾರ್ದು ಅಂತ, ಇನ್ನೊಂದು ಒಳಗಡೆ ನಾವೆಲ್ಲ ಗ್ರಾಫ್ಟ್ ಎಲ್ಲ ಹಾಕಿರ್ತೀವಿ ಅದಕ್ಕೊಂದು ಸ್ಟೆಬಿಲಿಟಿ ಸಿಗಲಿ ಅಂತ. ಆಯಿತಾ? ಅದು ನಿಮಗೆ ಮತ್ತೆ ನೀವು ಎಚ್ಚರ ಆಗೋಕ್ಕೂ ಹೇಳ್ತಾ ಇರ್ತೀವಿ. ಬಾದೇನೆಲ್ಲ ಡಿಸ್ಕಂಫರ್ಟ್ ಇರುತ್ತೆ ಸ್ವಲ್ಪ, ಅದಕ್ಕೆ ಏನು ಬೇಕು ಮೆಡಿಸಿನ್ಸ್ ಎಲ್ಲ ಕೊಟ್ಟಿರ್ತೀವಿ. ಕಣ್ಣಲ್ಲೆಲ್ಲ ಬಾವು ಇರುತ್ತೆ, ಗಾಬರಿ ಆಗಬೇಡ್ರಿ ಆಯಿತಾ? ನಿಧಾನಕ್ಕೆ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಅದಕ್ಕೇನು ಬೇಕು ಮೆಡಿಸಿನ್ಸ್ ಎಲ್ಲ ಕೊಡ್ತೀವಿ. ಮೂಗಲ್ಲಿ ಕಣ್ಣಲ್ಲಿ ನೀರು ಬರೋದು ಅದೆಲ್ಲ ಕಾಮನ್. ಅರ್ಥ ಆಯ್ತಾ? ಆರಾಮಾಗಿ ಸ್ವಲ್ಪ ಮಲ್ಕೊಳ್ಳಿ ಒಂದು 2 ನಿಮಿಷ. Alright, now we are starting the surgery. So this is a view where you can see very wide ala basis, depressed nose. So which you can appreciate in this profile. His radix is really low. So we are planning to augment the radix, dorsum, increase the projection, rotate the tip, which will make his nose look better. And also this view you can see the size and shape of the nostrils, the orientation of the nostrils which are horizontally placed, which has to be corrected. The tip projection is low. In the front profile as well you can see there's no Alright, so here we are with immediate results after surgery. You can see the clear increase in the radix height, projection of the nose, and also rotation of the tip which was drooping down before surgery. So this is another profile view where you can see the augmentation of the radix, dorsal aesthetic lines. So this is before surgery. You can see very low radix, height has been increased, and also you can see the width ala base which has been reduced. So today is first day following rhinoplasty for this patient. The patient is in the ward, is doing good. We have started him on normal diet, oral diet. So let's see how he is doing. ನಮಸ್ಕಾರ, ಹೇಗಿದ್ದೀರಿ? ಆರಾಮಿದ್ದೀರಿ? ಕರ್ಕೊಂಡೋಗೋಣ ಅಂತ ಬಂದೆ. ನೋವು ಹೇಗಿದೆ? ನೋವೇನಷ್ಟಿಲ್ಲ, ಬ್ಲೀಡಿಂಗು ಅಷ್ಟಿಲ್ಲ. ಮಾಡಿ ನನಗೆ ಹೊರಗೆ ಹಾಕಿ. ಊಟ ತಿಂಡಿ
ಮಾಡಿದೆ ಸರ್,
ಓಕೆ. ಜ್ವರ ಏನಿಲ್ಲ ಅಲ್ಲ? ಚಳಿ ಏನಾರು ಆಗ್ತಿದೆಯಾ? ಓಡಾಡ್ತಾ ಇದ್ದೀರಾ?
ಹೌದು ಸರ್,
ಓಡಾಡಬೇಕು. ನಾನು ಹೇಳಿದ್ದೆ ನಿಮಗೆ ಮಲ್ಕೊಂಡೇ ಇರಬೇಕು. Day 3 following rhinoplasty surgery. Let's see how the patient is doing. ನಮಸ್ತೆ. So we're doing the dressing for this patient. Today is day 3 following his nose job. He's doing fine. There's no much pain or swelling that he's saying. And also the swelling around his eyes is coming down. If you can see here, can you please focus this? Right? Kannu open ಮಾಡಿ. So the plaster is intact, and the yesterday's and the day 1 swelling was too much and it is coming down. So as the day 3 comes in, the patient swelling as well as the pain and the discomfort near the chest as well as in the nose starts coming down. So he's still on 2 types of painkillers and antibiotics, which is helping him for the recovery. So maybe today evening or tomorrow we are taking out the pack that is kept inside his nose so that he'll be able to breathe better. So today is day 5 following his rhinoplasty surgery. So patient is doing fine now. There's a pack inside his nose which I told you before. So we keep it for 5 days, especially in these cases where we do reconstruction using a rib cartilage. So we are going to take it out today so that the patient will be able to finally breathe from his nose after 5 days. ಆರಾಮಾಗಿ ಎಳಿಬೇಡಿ, ತಲೆ ಎಳ್ಕೊಂಬೇಡಿ. ನಾನು ನಿಧಾನಕ್ಕೆ ತೆಗಿತೀನಿ, ಬಾಯಿಂದ ಉಸಿರು ತಗೊಳ್ಳಿ. ಆರಾಮ ಅನಿಸುತ್ತೆ ಅಷ್ಟೇ. ಮುಗೀತು, ಒಂದು ಸೈಡ್ ಮುಗೀತು, ಇನ್ನೊಂದು ಸೈಡ್ ತೆಗಿತೀನಿ. ನಿಧಾನ ಆರಾಮಾಗಿ. ಓಕೆ, ಮೂಗಿಂದ ಉಸಿರು ನಿಧಾನಕ್ಕೆ. Alright, so now today is 10 days following septorhinoplasty for this patient. The patient had issues with the septum, dorsum, tip, radix. So overall we have done an open structure rhinoplasty including the septum, so it's septorhinoplasty. So today is exciting day for the patient because we are removing the splint. Right, so let's remove the splint now. Alright, so this is how he's looking. So this will show you the before and after now. So you can see the very wide dorsum and radix before surgery that has been refined. So it's got a beautiful dorsal aesthetic lines on both the sides. Height has been increased, which you can appreciate in the side profile now. You can see the increase in height, which was very low radix, very low dorsal aesthetic lines. This height has been increased now. Very importantly, you can see the tip there, which was looking down. The tip has been brought back, it has been elevated, and the nasolabial angle has been increased. You can see the difference now, increase in the height has been increased, got a beautiful dorsal aesthetic lines on both the sides, and also the tip, which was unsupported, if you remember, the good tip support now. So you can see the improvement in the lateral profile as well for this patient. It's got a good dorsum now. We have done the augmentation using the Turkish delight. So we got a basal view, very important view in this patient. You can see the very wide ala flaring there, wide ala base. We have done alaplasty on both the sides. It's got a good triangle, which you can appreciate. And also he had got a bifid kind of a tip, which was droopy. The tip has been raised up, and also you can appreciate on both the sides he has got a beautiful dorsal aesthetic lines visible from this view as well, which was flat before surgery. So all of this has been done using rib cartilage for this patient, for this augmentation, which is completely normal. And importantly, this nose is now looking natural. This compression is because of the bandage, which will settle in another few hours. So completely scarless surgery. You cannot see any scar visible because everything is done from bottom of his nose. So ಹೇಗಿದೆ, ನೋವೇನಾದರೂ ಇದೆಯಾ? ಇಲ್ಲ ಸರ್, ನೋವೇನೂ ಇಲ್ಲ. ಓಕೆ, ಎದೆ ಭಾಗದಲ್ಲಿ ಏನಾದರೂ ನೋವಿಲ್ಲ? ನೋವಿಲ್ಲ. So this is what is the common question apprehensive patients ask me, whether rib harvest is painful or not. So the patient is right beside me. He's saying he's having no pain. Usually the pain settles in first 2 to 3 days after surgery, especially in the rib side. He's completely fine. He's walking on his own. There's no issues with the nose, no issues with the rib. ಮತ್ತೆ ಇಂಪಾರ್ಟೆಂಟ್ ಏನಪ್ಪಾ ಅಂದ್ರೆ, ಎದುರುಗಡೆಯಿಂದ ಯಾರಿಗೆ ನೋಡಿದ್ರು ಸರ್ಜರಿ ಆಗಿದೆ ಅಂತ ಕಾಣಿಸಲ್ಲ. ಇಲ್ಲ ಇಲ್ಲ, ಕಾಣಿಸಲ್ಲ, ಚಾನ್ಸ್ ಇಲ್ಲ. ಯಾಕೆ ಅಂದ್ರೆ ನಾವೆಲ್ಲ ಮಾಡಿರೋ ಸರ್ಜರಿ ಕೆಳಗಿಂದ. ಆಮೇಲೆ ಇವ್ರದ್ದು ಇಂಪಾರ್ಟೆಂಟ್ ನೋಡಿ, ಎಷ್ಟು ಅವ್ರದ್ದು ಮುಂಚೆ ಹೆಂಗಿತ್ತು ಇವ್ರ ಟಿಪ್ ಅಂದ್ರೆ ಕೆಳಗಿತ್ತು, ನೆಲ ನೋಡ್ತಿತ್ತು. ಈಗ ಬ್ಯೂಟಿಫುಲ್ ಆಗಿ ಎದ್ದು ನಿಂತ್ಕೊಂಡಿದೆ. ಇಂಪಾರ್ಟೆಂಟ್, ಸರ್ಜರಿಗಿಂತ ಮುಂಚೆ ಮುಟ್ ನೋಡಿದ್ರೆ ಒಳಗೆ ಹೋಗ್ತಾ ಇತ್ತು, ಟಿಪ್ ಸಪೋರ್ಟ್ ಇರಲಿಲ್ಲ. ಈಗ ನೋಡಿ ಎಷ್ಟು ಚೆನ್ನಾಗಿದೆ. ಚೆನ್ನಾಗಿದೆ, ಖುಷಿನಾ? ಹೌದು ಸರ್, ಚೆನ್ನಾಗಿದೆ. ಓಕೆ, ಸರಿ ಬಂದದ್ರಿ. ಬೇರೆ ಏನಾದ್ರು ಡೌಟ್ ಇದ್ರೆ ಕೇಳ್ಬೋದು. ಮುಖ ಎಲ್ಲ ತೊಳಿಬೋದು, ಶೇವ್ ಮಾಡ್ಕೊಳ್ಳಿ, ಎಲ್ಲ ಮಾಡಿ, ಮುಖಕ್ಕೆ ಸೋಪ್ ಫೇಸ್ ವಾಶ್ ಹಚ್ಚಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಅಲ್ಲಿ ಇರಿ. ಏನಾದ್ರು ಡೌಟ್ ಇದ್ರೆ ಕಾಲ್ ಮಾಡಿ. ಭಾಳ ಚೆನ್ನಾಗಿದೆ.
ಸರಿಯಾಗಿದೆ
ಆಯ್ತಾ?
ನಮ್ಗೆ ಖುಷಿ ಆಯ್ತು.
ಭಾಳ ಚೆನ್ನಾಗಿದೆ. ಅದಿನ್ನೂ ಸರ್ಜರಿ ಟೈಮಲ್ಲಿ ಇನ್ನೂ ಸ್ವೆಲ್ಲಿಂಗ್ ಇತ್ತು, ಈಗ ಒಳ್ಳೆ ಶೇಪ್ ಬಂದಿದೆ.
ಥ್ಯಾಂಕ್ಸ್. ಈಗ ನಾವು 3 ತಿಂಗಳಾಗನೇ ಬರೋದು.
ನಮಸ್ತೆ, ಯಲ್ಲಾಪುರ ತಾಲೂಕಿನಿಂದ ನಾನು ಬಂದುಬಿಟ್ಟು ಇಲ್ಲಿ ಶಿವಮೊಗ್ಗ ಆಸ್ಪತ್ರೆಯಲ್ಲಿರೋ ಪ್ರಾಯ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಭೇಟಿ ಕೊಟ್ಟಿದ್ದೀನಿ. ನಾನು ರೈನೋಪ್ಲಾಸ್ಟಿಗೋಸ್ಕರ ಇಲ್ಲಿ ಬಂದು ಅಡ್ಮಿಟ್ ಆಗಿದ್ದೀನಿ. ಏನಪ್ಪ ಅಂತಂದರೆ ನಾನು ಸ್ವಲ್ಪ ಮೂಗು ಕರೆಕ್ಷನ್ ಇತ್ತು, ಹಾಗಾಗಿ ನಾನು ಡಾಕ್ಟರ್ ಪ್ರಜ್ವಲ್ ಸರ್ ಭೇಟಿಯಾದೆ. ಅವರು ಇಮಿಡಿಯೇಟ್ಲಿ ಏನಪ್ಪ ಅಂತಂದ್ರೆ ನನಗೆ 24ನೇ ತಾರೀಕಿಗೆ ಅಡ್ಮಿಟ್ ಮಾಡ್ಕೊಂಡು ಅವತ್ತೇ ಕೂಡ ಸರ್ಜರಿ ಮಾಡಿದ್ರು. ನನಗೆ ಒಂದು ದಿನ ಸರ್ಜರಿ ಮಾಡೋ ಬಳಿಕ ಮರನೇ ದಿನ ಒಂದು ದಿನ ಪೇನ್ ಇತ್ತು. ಇವಾಗ ಏನಪ್ಪ ಸದ್ಯಕ್ಕೆ ಯಾವುದೂ ಪೇನ್ ಇಲ್ಲ, ಒಳ್ಳೆ ರೀತಿಯಂಥ ಆಪ್ರೇಷನ್ ಆಗಿದೆ. ಅಲ್ಲಿರುವಂಥ ಸಿಬ್ಬಂದಿಗಳು ಎಲ್ಲರೂ 24/7 ಥರ ಹೇಗೆ ಸಿಬ್ಬಂದಿಗಳು ಪೇಷಂಟ್ಗಳು ಒಳ್ಳೆಯ ರೀತಿಯಿಂದ ವ್ಯವಸ್ಥೆ ಮಾಡ್ತಾರೆ. ಹಾಗೂ ಊಟದ ಕೂಡ ವ್ಯವಸ್ಥೆ ಇದೆ, ಒಳ್ಳೆಯ ವ್ಯವಸ್ಥೆ ಇದೆ. ಆ್ಯಕ್ಚುಲಿ ಇರಬೇಕಾಗಿದ್ದು 5 ದಿನ, ನಾನು ಅವರು ರಿಕ್ವೆಸ್ಟ್ ಮೇಲೆ ಇನ್ನೂ 2 ದಿನ ಹೆಚ್ಚಿಗೆ ಇರಬೇಕಂತ ಹೇಳಿದ್ರು. ಇದು ಬಿಟ್ಟೆ ಒಳ್ಳೆಯ ಒಂದು ಸಜೆಷನ್ ಇದೆ. ಒಂದು ಸಾರಿ ಎಲ್ಲರೂ ಕೂಡ ತಮ್ಗೆ ಏನೇ ಸಮಸ್ಯೆ ಇದ್ದರೂ, ಮುಗಿನ ಸಮಸ್ಯೆ ಇದ್ದರೂ, ಯಾವುದೇ ಸಮಸ್ಯೆ ಇದ್ದರೂ ಕೂಡ ಒಂದು ಪ್ರಾಯ ಹಾಸ್ಪಿಟಲ್, ಶಿವಮೊಗ್ಗದಲ್ಲಿರೋ ಪ್ರಾಯ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬಂದು ವಿಸಿಟ್ ಮಾಡಬೇಕಾಗಿ ಧನ್ಯವಾದ.